Assalamualaikum warahmatullahi wabarakatuh. Thank you everybody for coming. Let me introduce myself first. My name is Widya. Now, I want to present to you about the journal Fracture of the Sternum in Children. Let's start it. Okay, this is the description of this journal. You can see the author of this journal. In recent years, there has been much interest in the treatment of adults with sternal fracture. However, in children, fracture of the sternum is an uncommon injury and isolated fracture has been reported on few occasions. It is widely believed that fractures of the sternum are usually caused by blunt trauma occurring in motor vehicle crashes. In our anecdotal experience, sternal fracture more often results from more minor trauma and is often an isolated injury. What is the aim? The aim was to study the mechanism, radiological characteristics, and accompanying injuries of sternal fracture in children. And then there is method. First, search our radiology database to identify children with possible sternal injury presenting to our hospital between July 19 and 98 and October 2001. We include all children who underwent plain radiography of the sternum and all children who had compute tomography of the thorax after trauma. 33 patients were identified from the database. The records and radiological reports of all 30 children were verified. 12 children had radiological evidence of sternal injury. All sternal fractures were identified by plain radiography. We look at the mechanism of injury, sternal fracture, pattern, and accompanying injuries in these children. The treatment for the sternal injury was also noted. This is the result of this journal. The increased pliability and elasticity of the gels just will reduce the susceptibility to fracture. Consequently, most reviews conclude childhood sternal fracture is usually the result of severe blunt trauma, typically motor vehicle crash, and the likelihood of intrathoracic injury is high. Children are said to be at risk for the development of significant arrhythmias, and admission to an intensive care unit has been advocated for children with sternal fracture. A lateral radiograph of the sternum is usually taken to confirm clinical diagnosis of sternal fracture because displacement and dislocation occur in the sagittal plane. However, interpretation is more difficult in children because the number of ossification centers and their pattern of appearance and function vary greatly. In addition, the synchondrosis between the first and second sternebrae in adolescents may be misinterpreted as a fracture, and plain radiography will fail to identify patients with undisplaced transichondral fractures. In addition to plain radiography or compute tomography, ultrasound may be used to demonstrate sternal fracture. It is most useful in children who are able to point to the site of tenderness. Ultrasound is less useful in children with diffuse sternal pain. In adults, two mechanisms of sternal injury have been described. The first results from direct compression applied to the anterior chest wall or the body of the sternum. The second type follows flexion compression injury to the upper thorax. In adults, direct sternal injuries are often accompanied by rib fractures. However, none of our children with sternal fracture after direct violence had rib fractures on clinical examination, reflecting greater pliability of the chest wall in children. Flexion compression injury results in fracture of the anterior cortex of the first or second sternum in 5 children and was indistinguishable radiologically from green stick fractures after die violence. This injury pattern contrasts with adults where the most common injury after indirect violence is dislocation or fracture dislocation of the manubriosternal joint with backward and downward displacement of the manubrium on the body. It is probable that increased flexibility of the spine in children permits the sternum to buckle without spinal injury. Okay, you all can see this table. There were 4 boys and 8 girls in age from 5 to 12 years. All 12 patients with sternal fracture had a history of trauma. So you can see this table. The conclusion of this journal is the sternum may be damaged by direct or indirect violence. Sternal fracture is often the result of subprecilinear minor trauma and commonly there is no intraocular injury. In our experience, by far the commonest sternal injury in children is isolated anterior cortical fracture. These patients were discharged safely from our emergency department without ECG monitoring. Further study is required to identify the role of ECG monitoring in children with sternal injury. All patients with indirect violence should have careful examination of the spine. Okay, that's all for me. Thank you for coming. See you soon. Wassalamualaikum warahmatullahi wabarakatuh.